You had mentioned that you use ketamine here for also for treating depression and anxiety or whatnot. So I'm curious, what kind of indications do you use ketamine for, and then do you use it in conjunction with TMS, and why?
So we use ketamine at Redemption Psychiatry. We've been doing it for the past year. We've again, trying to stay on the cutting edge of things. We found that the research is robust enough to say this is worth bringing to our patients. But it really stands to reason that using ketamine, which helps to improve the interconnectivity in the neurons, complements in a very positive way, complementing the effect of TMS treatment, because we're working on the frequency of the overall activity of the neurons. And so if we can improve the connectivity, and we can improve and alter the frequency, then we're working on the two main aspects that we need to have a good solid communication. And so the brain's communication, so that it is functioning optimally, is going to definitely rely on whether it's if it's overactive, that we can inhibit that overactivity; if it's underactive, that we can stimulate it. But if it's not connected, that's a much harder thing to deal with. And so we found that ketamine helps to improve that connection, but the long-term results, and that's a big thing that I think is really difficult in any ketamine clinic, is that people, they have really great results, but then they want to make sure that that maintains. And sometimes it can be very difficult to have to come in and get maintenance treatments for ketamine, and certainly cost and time. And so if we follow up ketamine infusions or do them simultaneously with TMS, is absolutely the best treatment that we've seen. I mean, a lot of times talking with patients in order to help them to understand what would be the most optimal for them, you're giving your personal experience and trying to help them to understand what you see day in and day out, the improvements that you see. But you can't really communicate that any better than to tell them, look, if I were in the same situation, if I try to picture everything that you're going through and use all of my knowledge to say, well, what would I do for myself? What would I prescribe to my parent, my brother or sister, my child, my wife? And I would say we would do a series of ketamine infusions along with the TMS, and for the best outcome. And I believe that hands down, that is absolutely the most effective. I think that people, if you say people that have all the money, all the time in the world, can, it's no object, would you offer them something different? Would you tell them to do anything different? No, I would say you do a series of TMS and ketamine together for the best outcome.
Do you do the ketamine treatment the day before they start TMS, or a couple of days, or a week before? What's the usual workup?
Yeah, one of the best things to do is to get a kind of a priming treatment where you start the ketamine a couple days before TMS. Start in with the TMS. After the first week, get another ketamine. First couple of days to a week, get another ketamine infusion. And so we should be getting through with the ketamine infusions within the first 3 weeks, first half of the TMS, and then finishing up the last 2-3 weeks of TMS.
Do you space the treatments between the ketamine and the TMS treatment, so they come in one day and do ketamine, and then they come in the next day and do the TMS, or you said there's 2 days?
So usually we'll do the TMS treatment a little bit earlier, a little bit before the ketamine. Get the TMS treatment that day, and then follow it up and get the ketamine infusion. Sometimes right after, sometimes a little bit later in the evening.